Our coverage begins with 7 Action News reporter Kim Russell and the plan to get those vaccines to teachers. Kim?
Yes, doctors are warning the public that they need to understand what the vaccine can and can't do for schools and how safe they are. At the same time, a message from schools that teachers should remain where they are in the line a priority.
I really think it should be, teachers should be high on that list, higher than professional athletes or other people that seem to have access in certain situations.
Dr. Stephen Matthews is superintendent of Novi Community Schools. He and other school leaders say it's hard to keep schools open as workers find themselves quarantined or sick. L'Anse Creuse Public Schools had to shut down all in-person learning for 2 weeks around Thanksgiving due to a lack of staff.
I think a vaccine is really, really critical to make sure these disruptions don't continue.
I think the main thing people need to understand is what the vaccine will do and what it won't do.
The information that we have on the virus is being updated literally on a daily basis.
I spoke to 2 doctors, Dr. Russell Faust, the medical director for the Oakland County Health Department, and Dr. Leonard Johnson, the program director and chief of infectious diseases division at Ascension St. John Hospital.
Studies show conclusively that 90 to 95% reduction in severe COVID infections.
They were testing whether the vaccine was safe and whether it was effective, meaning did it reduce your chance of becoming infected with COVID-19. What it didn't do is kind of look downstream at whether the virus prevented you, if you did become infected, prevented you from transmitting it to someone else.
What we need to understand is that just because people are going to get vaccinated doesn't mean the mask can come off. Because what we don't know is whether people can still get infected at a lower level, and we call asymptomatic, and potentially carry the virus and spread it to others.
School leaders say they are focusing on what it will mean for staff to feel protected from severe illness as a start.
Protecting our staff, make it so that we can run schools with as many staff members as possible.
And I think having a vaccine will just give them more confidence that they are protected.
Now, of course, the questions these doctors addressed don't just impact schools, but all of us. For the time being, we're going to be asked to continue wearing masks, socially distancing, and avoiding large gatherings, even if we have been vaccinated. Reporting live, Kim Russell, 7 Action News.
Well, I'll have to do our part. Thank you so much, Kim, for the live report.